For more than 70 years, Uganda has trained medical workers and specialists, but due to poor remuneration, many have opted for greener pastures abroad. Even with those who prefer to remain in Uganda, are unable to cope due to the huge shortage, with some opting to retire.
Like psychiatrists, we don't have enough of them. But we know that in every regional referral hospital, we must be having a psychiatrist. We have very few hematologists, and that has been pertaining for many years. Hematologists are people who deal with diseases and understanding of the blood. Oncologists in this country are very few. Nephrologists, the people who deal with diseases of the kidney, are very few. Cardiologists are also very few.
Sometimes the conditions, the terms that are being offered are not attractive to them. So there is also a high rate of attrition as well, as a result of a number of factors.
According to a report from the Ministry of Public Service that NTV has seen, out of the 688 medical specialists needed in the country, there are only 339 specialists in the country. Out of the approved structure of the medical specialists needed in the country, there are only 2 anesthesia consultants out of the 17 required. There is only 1 cardiothoracic surgeon out of the 4 needed. The ministry does not have a clinical oncology consultant out of the 4 approved on the structure. There is also 0 pharmacist and physician consultants in the Ministry of Health. There is no surgery consultant of the 5 needed, and many other areas in the medical field.
There are instances where we have had Russians, Chinese, Cubans who have come in to fill these gaps. Yes. And if the money could afford, literally anyone would come and fill in these gaps. We have also had British filling up the gaps in the orthopedic department.
These, among many other gaps existing in the Ministry of Health, have prompted the government to review the public service standing orders to revise the retirement age of medical specialists from 60 years to 70 years. The Public Service Minister Muruli Mukasa says the proposal is only catering for medical specialists but not the entire civil service.
Other cadres in the public service, with the exception of judges, remain at the same mandatory retirement age of 60 years. In other words, government is not going to raise the retirement age.
Muruli says the medical specialists who are retiring will be reappointed on a contract of 3 years, renewable thrice. He was addressing journalists at the media center today. The minister says the proposed changes are intended to bridge the existing gaps in the Ministry of Health, but not to disadvantage the young people. Government recently enhanced salaries of medical workers as a motivator to reduce on the high rate of attrition of medical workers.
And the enhancement is going to be progressive until we reach a point where it may no longer be necessary for somebody, a specialist, to go and work outside this country.
Jingo Francis, NTV Weekend Edition.